It is, oh, there we go. It is now 4:34, and this is the Joint Budget Subcommittee on Health for General Budget Conference Committee. It is Tuesday, March 18th, again about 4:34 p.m. My name is Gustavo Rivera, State Senator for the 33rd District in the Bronx, Chair of the Health Committee in the Senate, and co-chair of the General Conference Health Subcommittee. I'd like to introduce the following Senate members who are with us today. To my right, and Chair of the Finance of the Insurance Committee, Senator Jamal Bailey, followed by Aging Committee Chair, Senator Cordell Clear, followed by Alcoholism and Substance Abuse Committee Chair, Senator Natalia Fernandez, and joined by Senator Leah Webb, and I forget the chairmanship that she has, but she has a chair. Women's issues. That was particularly, sorry about that, Senator Leah Webb. Certainly last but not least. And for the Republican minority, we are joined by Senator Patrick Gallivan, ranking member of the Health Committee in the Senate.
Thank you, Senator Rivera. I am Amy Paulin. My titles are Health Chair in the State Assembly, and I am co-chair with my esteemed colleague to my right, Gustavo Rivera, of the Health Committee Conference Committee, or the Health Subcommittee General Conference, whatever. I'd like to introduce the following members in the Assembly who are part of the committee. We have to my left, Assemblyman David Weprin. To his left, Assemblywoman Rebecca Seawright. Going down the line, Assemblywoman Carinas Reyes, and then our alternates on the Democratic side, Assemblywoman Rebecca Cassay and Assemblyman Kalman Yeager, and then our rankers, Assemblyman Josh Jensen, and the alternate is Jake Blumenkrantz.
So I will go over the Joint Subcommittee guidelines, a shortened version of them. I will not do every single one. 1, co-chair shall determine that all matters of parliamentary procedure unless otherwise specified by the rules. 2, the co-chair shall designate a staff person to serve as secretary for the purpose of taking minutes. We will do that shortly. 3, an alternate may participate in a subcommittee meeting but shall not vote upon any deliberations of such subcommittee unless he, she, or they has been designated to fill an excused vacancy in such a subcommittee. 4, no subcommittee members or alternate members shall be permitted to participate via proxy. 5, subcommittees shall restrict their deliberations to the respective subject areas as determined by the General Conference Committee. 6, each member shall be permitted a reasonable period of time as determined by the co-chairs to discuss any matter germane to the subject area of that subcommittee. And 7, no report shall be filed except upon the affirmative vote of a majority of the members of each house's delegation of the subcommittee. Now, as far as the Senate, Carla Nazar, right behind us, Carla Nazar, will serve as the recording secretary for the Senate.
And Ciara Stevenson, where are you? Over there. And she will serve as the recording secretary for the Assembly. Major issues that will need to be addressed at this conference subcommittee include capital funding, hospitals, distressed hospitals, nursing home and assisted living providers, nutrition assistance programs, reproductive health grant funding, CHAS with a double H, school-based health centers, and the early intervention rates, among several more.
Ditto on all the above, and the Senate looks forward to working with the Assembly and the Executive to restore vital funding and increasing Medicaid reimbursement rate for hospitals and nursing homes. Certainly, we're going to have a lot of discussions about that, the extra funding that we have related to the MCO tax and where that's going to be invested. We also want to make sure that, as it relates to early intervention and other providers, we provide some support for that, as well as providing additional operating and capital funding for hospitals, increased funding for reproductive health, particularly in these moments, nutrition assistance programs, school-based health centers. That is definitely something that we're going to discuss, incredibly important one, And we cannot forget about the Medical Indemnity Fund and its continued existence, as well as enhancing health coverage for all New Yorkers.
So we look forward to continuing these conversations, and I will open it up for any comments, maybe on the Senate side first.
We'll start with if my colleagues want to chime in at all. Senator Bailey.
Thank you, Senator Rivera. I just wanted to thank my colleagues here in the Senate, in the Assembly, and in the Executive Office for looking to wade through what is a challenging time, but you should be sure that the hands of these conferences are in the right place, and the heads and hearts in the conference in these right places in terms of resolving these very important and specific issues. Thank you.
Senator Clear.
Thank you. I too want to thank Chair Rivera, Paul, and my colleagues for these deliberations that are so very important. I'm Senator Cordell Clear. I chair the Aging Committee. I have to lift up all the needs for our seniors and our older New Yorkers and make sure that their health care needs are being taken care of. And I'm sure that's what we will be doing. Thank you.
Thank you, Senator Clear. Senator Fernandez.
Good afternoon. Thank you so much. Senator Fernandez, Chair of Alcoholism and Substance Use Disorder. I really want to thank the Chair and my colleagues for the work that we put into shaping not only our one house, but our values and priorities in this budget, and particularly for both of our houses for supporting the 7.8 inflationary budget increase. We need to make sure our workforce is able to live, to sustain their families, and to be able to care for our neighbors just as well. So thank you so much.
Thank you, Senator Fernandez. Senator Webb.
Thank you to Chair Rivera and also to Chair Paulin. We have most certainly find ourselves at a critical juncture as we continue to make key investments, and most certainly in healthcare. As the Chair of Women's Issues, we know that a lot of the challenges we are seeing in the areas of women's health, it is paramount that as a state, we continue to make progress in the areas of reproductive rights and maternal health and many other areas. And I look forward to the continued deliberations that we will have, and most certainly the equitable investments we will make on behalf of all New Yorkers in our great state. So thank you to my colleagues as well, and to everyone who continues to advocate for our shared well-being. Thank you.
Thank you, Senator Webb. And from the Republican minority, Senator Gallivan.
Thank you, Chair Rivera. I'm pleased to see that both the Senate and Assembly One House bills include increased funding for hospitals, nursing homes, assisted living home care, and early intervention, which is necessary, of course, to ensure our state's healthcare delivery system remains viable. Also pleased that funding is allocated for financially distressed hospitals, a vital investment that stabilizes our healthcare system and ensures the continuous delivery of essential services. I have a number of concerns, three that I want to mention today. The first, the One House budget's failure to delay and include measures to support the CDPAP home care transition. With only 13 business days left until the deadline and only 140,000 patients registered as of March 10th, I have serious concerns that patient care will be significantly disrupted when this transition takes effect on April 1st. The second is a proposal on reporting on material transactions. I believe there will be unintended consequences for independent healthcare practices across New York State. The length of the review periods is problematic. I believe it'll limit patient choice, ultimately making healthcare costs higher. And the last area of concern that I want to mention today is the weakening of Medicaid cost controls within the One House budgets. While I welcome the Senate and Assembly's increased funding for hospitals, nursing homes, and other programs, the Senate's repeal of the Medicaid global cap eliminates a crucial safeguard designed to keep Medicaid spending within its allocated budget. Both houses have shown a strong commitment to maintain the continuum of care while enhancing healthcare infrastructure and essential services. I look forward to working with my colleagues to do this in a fiscally responsible manner that ensures adequate resources for statewide healthcare initiatives are indeed in place. Thank you.
Thank you, Senator Gallivan. Assemblymember Paulin.
So we'll follow the Senate's lead, and I'll call on those members who are members and, alternates, not so much. Okay? All right. To my left, Chair of the Insurance Committee, David Wepper.
Good evening. Thank you, Chair Paulin. As Insurance Chair, I'm committed to ensuring that New Yorkers have access to a full array of necessary health care services and that New York maintains a robust and affordable insurance market. In the past years, this is my third year as Insurance Chair, we've made great strides in increasing accessibility to health care and bolstering protections for policyholders, but our work is not done. We must continue to develop, report, and ultimately codify legislation that will improve the quality and accessibility of insurance products sold in New York State. Thank you.
And our aging chair, Rebecca Seawright.
Thank you, Chairwoman Pollen and Chairman Rivera. I would also like to thank Chairman Pretlow and Chairwoman Kruger for their leadership during all of the budget hearings. The Assembly One House budget proposal provides meaningful investments in our aging population statewide, and the need for this investment is crucial. Far too often, we see seniors being forced into nursing homes, costing the state millions of dollars, when alternative programs such as Aging in Place, naturally occurring retirement communities, and home sharing programs are often better fits for aging New Yorkers. I look forward to passing a final budget that truly meets the needs of our aging population and allows them to live out their retirement in a meaningful manner. Thank you.
Thank you. And Assemblywoman Extraordinaire, Carinas Reyes.
Thank you, Chair Paulin, and thank you to Chair Rivera for the opportunity to serve on this committee. Priorities that I think we share, CHAS, Certified Home Health Agencies, making sure that we have those resources to really decant some of our nursing hospital beds and hospital emergency room beds is a priority for us. We know that it is a huge cost to the state to maintain people in hospital where they can be taken care of at home. I am heartened to see that we've increased funding for the Nurse Family Partnership, and of course would always advocate for an increase in that as well, and continue to advocate for our priorities in the legislature around reproductive health, women's health, access for health care for our seniors, and the cost of prescription drugs. Thank you.
And our Republican ranker on the Health Committee, Josh Jensen.
I want to thank Co-Chair Paul and Co-Chair Rivera for allowing me to speak on behalf of the Assembly Minority Conference. As we enter the final stages of budget negotiations, we urge the importance of those discussions happening on a five-way basis to ensure that the diverse perspectives of all New Yorkers are fully represented and valued. Healthcare represents the largest area of spending in the budget, aimed at addressing public health challenges and ensuring that all New Yorkers receive the care they need. The Assembly Minority Conference would like to see a budget that balances fiscal responsibility while also supporting the healthcare workforce, our healthcare facilities, patients, and vulnerable New Yorkers. Medicaid is a vital program for the elderly, individuals with disabilities, and low-income New Yorkers. However, we are concerned about the continued expansions of Medicaid and the use of budgeting gimmicks that may jeopardize the program's fiscal stability in the future. With large investments being made through the enacted MCO tax, we would like to see increased transparency in the waiver process, as well as additional reporting on the investments to all members of the legislature. Regarding early intervention, the Assembly Minority Conference supports investment in providers to ensure access to these critically important services. The Assembly Minority Conference also supports addressing issues with the Medical Indemnity Fund, but urges any budget proposal be publicly available with enough time for review before passage. With no recent updates on the transition to a statewide intermediary for CDPAP, the Assembly Minority Conference is concerned that neither the governor nor either legislative majority has proposed solutions to address the slow transition and concerns that stakeholders have that have gone unanswered. We hope that we can prioritize fiscal responsibility and spending restraint as economics and political experts urge times of caution. We look forward to working together through an open and transparent process to enact an on-time budget that exercises fiscal restraint while addressing the healthcare challenges impacting all New Yorkers. Thank you.
So that concludes the health conference, first meeting. We look forward to continuing the conversation with each other and with the executive branch to have an on-time budget, or as close to on-time as we can get. Senator,
Yeah.
thank you all.